One common thing we hear in the office is, Doc, I got the best sleep whenever I went home after that adjustment. The reason why this happens is everybody's typically in a sympathetic overdrive, more than 90% of patients, 90% of people. And that's simply because of overworked, family dynamics, financial status, relationship status. All these things right here typically cause you to be more anxious, more in a fight or flight, okay? And so there's never really anything to regulate and bring that into a more relaxed state. There's no trigger for it. There's no point where you can stop and actually get that. You might go get a spa day. You might just tell, hey, everybody leave me alone for 10 minutes. That might bring you down a little bit, but overall, 90% of the time you're in this fight or flight sympathetic. Well, whenever you come in to get adjusted here, what we're doing is we're analyzing neurologically how your body's functioning. We're analyzing the breath, right? So the breath is a good dictator of how the brain's functioning. If it's very rapid breathing, okay, then you're in a sympathetic, all right? Whenever it slows down and we check the heart rate and the blood pressure and it's more on the lower end, right? You're at a more 50 to 60 resting beats per minute, then we know that you can be closer to that parasympathetic. Well, whenever you're addressing the cervical spine, what happens is typically whenever patients get that adjusted, they have told us that when they come back, it's like a weight has been taken off their shoulders. They can actually get the rest that their body needs because you're stimulating the nerves that are so close to the brain, the vagus nerve, which is one of them, which causes the change in breath, the change in the heartbeat, the change in how the body is digesting its food. It's bringing you closer to parasympathetic. There's actually ganglions that run through the brain there and also in those glands that allow you to activate that parasympathetic part of the body. So it's almost bringing it upon you to choose rest. Whenever you get that adjustment, one common thing I see is I'll drop the adjustment when we're addressing the occiput, and they will get this deep breath in their belly. But before that, if you won't say anything, you'll notice that they're just breathing from the chest. And then you do the adjustment, and then all of a sudden you just see their belly just start to breathe, and you're like, look at that. Without even calling any cues or anything like that. That is an automatic sign that they have switched from sympathetic to parasympathetic just from the change of the breath. So whenever you're in that parasympathetic, you're in rest and digest. Rest, sleep, and digest. That means that the organs are working, right? So when you're in parasympathetic, that means that there's blood that the blood in your body has to pick where it's gonna go. So if you are in a fight or flight, sympathetic, then your blood has no option. Automatically it's gonna shunt to your extremities. And then two, the important things to help you fight or flight. So the eyes are gonna dilate, the heart rate's gonna start beating faster to get you ready to defend yourself or to fight for your life. It's just how the body's designed. If you're in a parasympathetic, they call it rest and digest because that's where you are whenever you rest. Whenever you sleep, you're in a more of a rest. The organs are now getting all the blood. Now you can digest your food. Now you can move the food down to do a bowel movement. That can only happen in a parasympathetic state. Even if it's briefly for a moment, it has to be in parasympathetic in order for those muscles to because they're involuntary muscles. So you can't just choose to activate that muscle. It has to activate on its own based off of how the system's being placed. So if it's in a parasympathetic, then it can contract and relax those muscles. So whenever you get this adjustment and it stimulates that parasympathetic in the body, and now some of those somatic muscles start to just relax, then you start to get, oh, I'm kind of tired. And you just fall into this beautiful deep sleep. That's one of my favorite things to hear about patients.